Frank Schioppa's PowerPoint presentation for Dr. Ethan Anderson's class of Function and Structure of the Human Body, summer term 2015. What is autism? Autism is a developmental condition that appears early in life, typically before the age of 3 years old, and affects the brain's normal development of social and communication skills throughout the entirety of a person's life. Autism affects the individual's sensory five senses, which is hearing, smell, taste, touch, and vision. And the way that it impacts it is that it literally overloads the brain's interpretation of those senses. So if you were somebody with autism, this is what it might feel like to have sensory overload. The autism spectrum, no two people with autism are the same. They each have their own strengths and weaknesses, just as non-autistic people have their own strengths and weaknesses. So just because two people have autism doesn't mean they have the same limitations and understandings. Also, because people with autism don't necessarily verbally speak, that doesn't mean they're any less intelligent. So people with autism, they're not intellectually damaged, and nonverbal doesn't mean stupid. Individuals with autism, they don't have to meet a certain IQ criteria. So what that means is that their IQs are not indicative of having autism. People with autism can either be at the high end of the IQ spectrum, they could be at the low end, or they can be in the middle. Their ability to handle situations and understand social cues are different from one another and are not related to their IQ ability or their IQ level. Now, some famous people that had autism that research was done and proved it are Thomas Jefferson, Michelangelo, Sir Isaac Newton, Albert Einstein, Charles Darwin, and Amadeus Mozart. And now, if you looked at these people, you would know that they weren't necessarily intellectually or IQ challenged. So that brings us to, what are the symptoms of autism? The symptoms of autism are impairment in social relationships. So there's no eye contact, facial expressions, or body postures and gestures. Individuals with autism, they fail to develop relationships with peers, they prefer to be alone, and they typically have a lack of a give-take kind of relationship. Another symptom of autism is impairment in social communication, and that can be a delay or lack of speech-language skills, or they provide unrelated answers to questions. Other aspects of the communication are, they could be repetitive words or phrases. They use few or no gestures. So, for example, if you're waving goodbye, chances are an autistic person will not wave goodbye. Another symptom of autism is the lack of an imaginative thought. And by that, it's the child will not pretend play with an imaginary friend, or they're obsessed with one particular interest. Also, they do not like typical change in their routine or their everyday environment. They'll have repetitive arm movements or shaking or flapping of the hands. Those are all symptoms of autism. All I can do is be me. This slide is pretty indicative of autism, again, because autism has many different symptoms between individuals. There, again, no two people with autism act the same or understand the same. So it's a very broad spectrum when you're diagnosed with autism as far as how impacted you are by it. The risk factors of autism. Autism doesn't have specific risk factors. Autism affects children of all races and nationalities, and there's really no certain criteria or factors that can really point to saying, well, this child is more susceptible to contracting autism. Some of the risk factors can be a child's sex. Typically, boys are more prone to have autism than girls are. Family history plays a huge role in autism. Families who have one child with autism, they have an increased risk of having their second child also with autism. Preterm babies, if a baby is born before 26 weeks of pregnancy, they're at a greater risk for autism. And also other indicators of autism are other disorders. For example, children with certain medical conditions have a higher risk of autism, such as if a child has Fragile X syndrome, Tourette syndrome, tuberous sclerosis, and Rett syndrome. Those all increase the chances of autism. Signs and tests of autism. Children showing signs of autism are recommended to receive a hearing test, a blood lead test, and a screening test. So if you have for example, if you have a baby by 12 months of age and they're not babbling, that would be a sign to have your child tested. Or if the child's not gesturing by 12 months, for example, pointing and waving, that would be a sign. Not saying single words by 16 months of age. Losing any language skills at any age would be a sign of autism. And children showing those signs should be tested. That leads us to the autistic behaviors of autism. People with autism have a broad behavior of behavior impairments. Autism is not limited to just one or two behaviors. These behaviors seem to relate to the constant rituals in their activities. They exhibit repetitive and compulsive behaviors which occur daily in terms of their nature and intensity. So you may be asking, well then, what are the treatments for autism? Unfortunately, there are no medications that can cure autism or treat the core symptoms. There are, however, medications that can help some people with autism to function better throughout the daily course of life. For example, medication might be prescribed to manage high energy levels or the inability to focus, or if the person has depression or seizures, medication can be prescribed to manage those particular symptoms. The best and most successful treatment is early intervention treatment plans. And a couple of those are applied behavior analysis, occupational therapy, and speech language therapy. And an experienced team can assist with designing the best treatment plan for that particular child's needs. The treatment plan, they're gonna vary depending on the child. Again, because no two autistic people have the same symptoms, they're not going to share the same treatment plans as well. So prevention methods. You're asking yourself, what's the best way to prevent autism? Again, because there's no cure for autism and there's no known cause for autism, there really is no prevention method for autism. To lower the rates of autism in the future, the aim should actually be on focusing efforts towards those therapy plans to make them more efficient and effective. Also, to gain awareness for autism, that would be a prevention method. To kind of gain funds to conduct research to possibly find out the causes of autism, to maybe down the road come up with a cure for autism. My final thoughts. I've really enjoyed creating this PowerPoint presentation and have learned so much to go with it. And I hope that this slideshow presentation has made people more aware of what autism is and has persuaded them to become more involved and open to this population of people that have autism. That concludes my PowerPoint presentation on autism. Thank you very much.